Hi guys, the topic for today is part of a 3-video series on how body type affects our strength for different movements. Now, the point of these videos is not just to talk with my fellow fitness nerds about how body type and anatomy affects the way that we exercise, but it's also a way to really highlight that it's not fair to yourself to be comparing yourself to others. There's so many factors that play into what our strengths and weaknesses are that comparing yourself to anybody else in the world is not fair to yourself, and it's not fair to others. The only person that we should be comparing ourselves to is ourselves. Are we getting better each day? Are we working our hardest to improve who we were from the day before? If so, you're on the right track. If you're comparing yourself to others, it's really not a fair thing to do, and you're gonna see that in this video series. On that same note, before we even get into the science of things, please keep in mind that what you see on social media isn't real. Most of what you see is highly edited, highly filtered, highly staged. A lot of the fitness influencers who claim to be all natural are on steroids and other performance enhancing drugs. On top of the fact that they also have freak genetics that most of the population like you and I don't have. So comparing yourself to those people is unrealistic from many different standpoints, and you shouldn't compare yourself to those people either. It'll never leave you feeling better about yourself in the end. If you're watching this, you're likely on a fitness journey. First of all, congratulations. Whether you are in the contemplation phase and you haven't officially started exercising or working out yet, or you're just getting into it, or you've been doing it for decades, if you are on any sort of fitness journey, you're already doing better than most of the population, statistically speaking. With that being said, let's get into how your body type affects the deadlift. Now, I don't like to play favorites, but in this case, I'm going to. The deadlift, in my opinion, is the best exercise that exists. It is this beautiful combination of upper and lower body muscle recruitment while also being extremely functional. So I am a little biased towards it, which is why I chose to record this video first. But why is it that some people make it look so easy to lift a ridiculous amount of weight while others is just a struggle to improve 5 pounds every few months? For the sake of this video, let's assume the following scenario. We have two athletes, two lifters, both of which are the same age, the same gender, exactly the same weight, and have been on the same training program for however long they've been working out. We'll say they're both very experienced lifters. Neither of them has any major injuries or other anatomical or physiological impairments that we really need to factor in. The only difference between the two athletes is that one has a tall, more slender build, while the other one has a short and stocky build. The tall, slender athlete has a 1-rep conventional deadlift max of 305 pounds. The short and stocky athlete has a 1-rep conventional deadlift max of 500 pounds. How is it that two people with such a similar background have such a difference in the amount that they can lift? Well, as you may have guessed, genetics plays a big role into this. A strength and conditioning researcher named Dr. Michael Hale actually conducted research on this to determine how a person's body proportions affects how much they can deadlift, and which variations of deadlifts may be most advantageous based on your body proportions. Before we get into the specific findings, let's just talk about one fact that almost doesn't even need to be said, but I'm going to say it anyway. For any lift, the shorter distance that you have to move the weight, the easier that exercise is going to be. You're going to be able to move more weight if you have to move that weight a shorter distance. So for someone like me who's 6'3", tall, lanky, naturally very thin, I spent a lot of time in college at the gym jealous of the short, stocky guys that were just tossing huge weight around for reps that was higher than what my 1-rep max is for any exercise. Well, now when I'm at the gym, I don't feel that jealousy anymore, but I am still a little envious of them, to be honest. If you are a tall, lanky person like myself, keep in mind that you do have a little bit of a biomechanical disadvantage from the beginning because the bar just has a further distance to move, or the weight has a further distance to move than for somebody who is shorter. That's not to say that you can't get really strong, because you certainly can, but biomechanically, you start off at a disadvantage. It goes deeper than just if you're tall or short, obviously. If that was all that it was, then this video would be pretty short and easy. Keep in mind that there are two basic common types of deadlift when we talk about barbell deadlifts. There's the conventional deadlift, which is characterized by your feet being more narrow than your hands, so your grip on the bar is outside of your legs. And then there's the sumo deadlift, which is characterized by your grip being inside your legs and your toes are pointing slightly outward. So it's a wide stance, toes pointed out, hands gripping the bar inside of your legs. The conventional deadlift, where your hands are outside of your legs, the one that most people think of when they probably think of a deadlift, requires more of a hip hinge and therefore incorporates more of the posterior chain. So when your hips are more hinged, your spinal erectors, your glutes, and your hamstrings have more muscle activation than the quadriceps, for instance. On the other side of that, with the sumo deadlift, you have more of an upright chest. It's more of a knee dominant movement. So you're gonna get more contraction out of the quadriceps and hip adductors than you will with the glutes and hamstrings. With those differences in mind, let's go back to what Dr. Hale found in his research. To sum up what Dr. Hale found, conventional deadlifts are biomechanically advantageous for people with longer arms in relation to their torso and legs, while the sumo deadlift is biomechanically advantageous for people with shorter arms in relation to their torso and legs. But also keep in mind that during a sumo deadlift, the bar travels about 25% less distance than during a conventional deadlift. So this creates a biomechanical advantage as well. To figure out where you fall on this scale, you can use the fingertip test. So all that you have to do for this is stand up perfectly straight with good posture and let your arms just hang down in a relaxed manner. No slouching, no reaching down, no bending at the hips. Just stand up tall, let your arms just hang as they normally would. Average arm length would be if your fingertips fall midway between the greater trochanter of your hip or the hip bone and the joint line of your knee. If your fingertips are lower than that, like mine, you can be considered to have long arms in relation to your torso. On the other hand, if your fingertips fall higher than that or closer to your hip, then you have short arms in relation to your torso. All this information is interesting, but ultimately, the best deadlift for you is the one that feels the best. Maybe you have a build like I do, tall, lean, lanky, but the sumo deadlift feels better for you. Dr. Hale's research shows that the conventional deadlift should be biomechanically easier for someone like me, but perhaps you're built like me and the sumo deadlift is easier. Then do the sumo deadlift. Or better yet, do some of each. You can get different advantages for each. Like I said, the conventional deadlift is going to place more muscle recruitment from the spinal erectors, glutes, and hamstrings, whereas the sumo deadlift, you're gonna get more recruitment out of the quads and the hip adductors. Try them both, get the benefits of both. Maybe you're someone with a history of chronic low back pain and the conventional deadlift just does not feel good at all. But maybe the sumo deadlift feels much better because it places so much less stress on your low back. Then do the sumo deadlift, or better yet, do a hex bar deadlift, which places even less stress on your low back. If you're someone that has a long history of patellofemoral pain or anterior knee pain, the sumo deadlift or a hex bar deadlift might not feel good at all because there's more compression on the kneecaps during that variation of the deadlift. Then do the conventional deadlift. I have a history of a left knee surgery, and the conventional deadlift feels much better for me than the sumo deadlift does. Try them both, mix them up if you can, and if one just isn't working for you, then do the one that feels the best. Don't just go off of what Dr. Hale's research shows. While I hope that you found this biomechanical research interesting like I did, there's really two morals of the story for this video. Number one, do the deadlift variation that feels the best for you, for your body. Don't worry about what the research says, do what is best for you. And the second moral of the story is that you really cannot compare yourself to others. Some are just born with biomechanical advantages while others aren't. In the end, it truly does not matter. Unless you are competing in powerlifting at a very high level, the actual amount of weight that you're lifting doesn't really matter. It's more about the journey, comparing yourself to yourself only, making sure that you are doing everything you can do to get better each day. And if you're doing that, you're already doing good enough. Which deadlift variation do you prefer? Let me know in the comments. I hope you enjoyed this video, and I will see you next time.